Senator Schlicher.
Thank you, Mr. President. Well, I rise in support of this amendment. You know, in our prior lives, we talk about, I work in an ER in an urban emergency department, and I see the people that are so homeless that they don't even qualify for HEN funding. They're the people that don't have anywhere to go, don't have ability to get into the Tacoma Rescue Mission for various reasons, have mental health issues, have problems with their ability to access care. And so they sometimes sleep in plastic chairs in my emergency department. And what this budget does is it says we're going to have another 35,000 people sleeping in plastic chairs in emergency departments rather than the housing they afford. And when we talk about living within our means, let's be clear. This budget says that 35,000 people that depend upon that source of funding for their housing now don't have the ability to live within their means that they were having. So those are the means that we're taking away. That's the choice that we're making. And when we do that, that means that we prioritize education over poverty, and we forget that at the end of the pen are people. There are people that are affected by these cuts. There are people that will be homeless. And we don't solve education by having more kids do their homework in their cars. Let's find a way to move forward and actually fund HEN. Thank you, Mr. President. Well, I rise in support of this amendment. I want to clarify something first. It's been talked about that this amendment is taking unused funds. Well, in fact, this isn't just taking unused funds. This is putting a cap on families. And I can't imagine now, with our third child on the way, if we were in a different circumstances, being told that, maybe you shouldn't have that child, because that's what this does. This is punishing women who choose life and choose to have a child and choose to do the hard work of raising one. And I know that my wife is going to be working incredibly hard this summer while I may not be around raising our 3 kids, working here. And I can't imagine anyone saying this to her. We have to do what's right. We have to get beyond this crisis-driven mentality. What are we doing where we wait until people are in crisis, and then when they're there, we kick them even further down? Come on, folks, this isn't a bargaining chip. These are people's lives. If we all agree that this is the right thing, why does this have to be a chip that's traded in the final budget games? I came here to make sure that the voice of my patients, of the homeless and the people that I serve every day got into this body. I didn't realize I'd have to be fighting to make sure we took care of children in the process. I strongly urge you to support this amendment. Let's do the right thing. But I strongly support it. This is just another symptom of this cost-shifting, fund transferring, smoke and mirror, gimmick-laden hooey to make this budget work, folks. I don't know how to put it any nicer than that. I can think of a lot of other words to say for it. But the reality is that this is the problem we have everywhere. It's not my problem, it's in your budget. It's not my silo, it's your silo. Well, guess what, folks? We're in healthcare trying to break down those silos so the cardiologist and the neurosurgeon talk to each other about things so we don't make mistakes. Why is it that it's okay to play these silo games in the budgets? We can just say, well, it's not our problem, it's the county's budget. And I have to say that my counties have not written saying, don't worry, it's a proportionate amount, don't worry, it's a small amount. They've had a quite different response. So, I have to stand in strong support of this and urge that we do the right thing. Let's do public safety. Let's protect the people. Thank you. I urge adoption.
Question before the Senate is adoption of Amendment 254. Those in favor will signify by saying aye. Aye. Those opposed, no. No. Noes have it. The amendment is not adopted.
I had not planned to speak on this amendment, but as an alumni of the University of Washington Medical Center, I have to rise in strong support of this amendment. The reality is, in case other members here didn't realize, there are residency programs that are supported by the university revenue system, most likely in every jurisdiction and every district in this room. From Spokane to Tacoma Family Medicine, to the Group Health in Seattle, to the University of Washington and Harborview Medical Centers, there are programs supported by the UWMC medical system throughout the state. And I think the point that really drives home here is that this is taking money away from patients, and this is taking money away from programs. This is decreasing access and increasing costs. I thought we were working to hold down medical costs, not increase them to benefit the state general fund. Please support this amendment.
Question before the Senate's adoption of Amendment 253. Those in favor will signify by saying aye. Aye. Those opposed, no. No. The noes have it. The amendment is not adopted.